Welcome to Your Health Today. I'm Christy Money, health educator from the Caldwell County Health Department, and I have with me today Chad Barr, our communicable disease nurse for the health department. Chad, so tell me a little bit about yourself and what you do for the health department.
Sure. So I do communicable disease for Caldwell County. The general public may not be aware, but local health departments are required by North Carolina law to investigate and report communicable diseases within each county. There are currently 66 reportable communicable diseases in North Carolina. Now, those communicable diseases, they range from sexually transmitted infections like chlamydia, gonorrhea, and syphilis, foodborne and waterborne illness like cryptosporidiosis, campylobacter, and salmonella, respiratory diseases, tuberculosis, Haemophilus influenza, and influenza and COVID-19 deaths. And then arboviral diseases like Rocky Mountain spotted fever, Lyme disease, and ehrlichiosis, and so on. As a communicable disease nurse, I'm responsible for the surveillance, the investigation, and the reporting of communicable diseases within Caldwell County. I work closely with our local hospitals, our local urgent cares, our local environmental health agency, and private practice to report and investigate those communicable diseases and to ensure that control measures are put in place to prevent the spread of those types of diseases.
That's great, Chad. I didn't know all of that. As long as I've been at the health department, I didn't realize that you had all that stuff in your category. And you mentioned influenza, and that you report influenza deaths and COVID deaths. Right now, I know it's a bad time for the flu.
That's right.
It seems like everybody has it.
That's
or
right.
Or has had it. We've not had any deaths in Caldwell County this flu season, right?
So we've not had any respiratory flu deaths that's been reported in Caldwell County. We have unfortunately had some COVID-19 related deaths in Caldwell County.
Right. So last month we talked about healthy holidays, basically. It's how to stay healthy when you're getting together with people. So schools just started back after being off for the break. Mm-hmm. So tell everybody, what can you do to kind of help prevent from getting the flu? Of course, always the flu shot.
Absolutely,
right?
Yeah.
And what else? What are other measures that they can do?
So Christy, we want to encourage everyone to get those vaccines. Make sure that you have, current vaccines, including influenza. They offer the RSV vaccine now, and also COVID-19 is offered. Secondly, wash your hands. Really good hand washing is effective in preventing respiratory illnesses. Limit your distance between individuals, and if you're sick, stay home. We don't want, you don't want to infect your coworkers. You don't want to infect your family and your friends. Right.
The hand washing thing, to me, is huge. It's like, I don't feel like people realize how important that is, maybe, and just trying to stop that virus from continuing on. Like if you're trying to stop it there, it's wash your hands.
That's right. Wash your hands.
I mean, that's so easy, right?
It's so
Washing
easy.
your hands. Just do it.
That's right. Yeah, it's often forgotten.
Yes.
And it's often a lot of individuals don't wash their hands effectively for the right amount of time, and using soap or hand sanitizer or whatever.
Right. That's good to know. I mean, that's good information. So you also mentioned the surveillance of communicable diseases. Are there any illnesses or diseases that you're following more closely, like right now, or that you have a reason to be concerned about?
Yes, absolutely. So syphilis rates in North Carolina and Caldwell County have continued a sharp increase since 2020. News agencies like WBTV News are beginning to cover this resurgence of syphilis throughout North Carolina and really the entire southeast, and reported just 2 days ago about a syphilis tsunami. That was the report. So as you can see in the graph, In 2018, Caldwell County only had 4 confirmed cases of syphilis. The number of confirmed syphilis cases actually declined in 2019, but since 2020, we have had 4 consecutive years of increased cases of syphilis here in Caldwell County.
That's crazy, Chad, that we've had that. So, of course, the question everybody has is, how do you get syphilis and how is it spread?
Right, sure. So syphilis is spread from person to person through direct sexual contact with a person who has syphilis. Syphilis can be spread through vaginal, anal, or oral sex and results in a lesion called a canker. Now, a canker lesion is usually, but not always, a firm and round and painless type sore or lesion. There can be one or there can be multiple lesions. The canker is the location, Christy, where the actual bacteria enters into the body. They usually appear within the first 6 weeks after the exposure, and they can last anywhere between 3 and 6 weeks. So they will eventually go away with or without treatment.
Okay.
But without treatment, syphilis will then progress into something we call secondary syphilis. And secondary syphilis, during that stage, is when a lot of individuals will develop a skin rash on the palms of their hands or on the soles of their feet. It's called a palmar or a plantar rash. Individuals can also have, with secondary syphilis, symptoms that mimic the flu, like fever, swollen lymph nodes, sore throat, headaches, muscle aches, and fatigue. Now, eventually, if syphilis is left untreated, it will lead to something called latent syphilis. And this is where it can become really dangerous. So the syphilis can affect multiple body organs, and those organs include your brain, your heart, your nerves, and can cause eye problems, can cause liver problems, and joint pain. So untreated syphilis can actually even become fatal.
That's so sad, so sad. So how do people prevent from contacting syphilis?
So condoms, when used correctly every time, reduce a person's risk of getting syphilis or contracting syphilis. Unfortunately, condoms are only protection when they cover the infected area and are sometimes not effective in the prevention of syphilis exposure. So the only for sure way to prevent syphilis is to be in a long-term, mutually monogamous relationship with a partner who does not have syphilis.
Okay. So are there like certain populations that are at greater risk for developing syphilis or like experience higher rates of syphilis?
Sure. Historically, gay and bisexual men experience higher rates of syphilis. However, in recent years, we have begun to see an increase in the number of women infected with syphilis. In fact, in 2023, we had 27 positive cases of syphilis in Caldwell County, and 15 of those were female and only 12 were male. So now women have surpassed the men in population. Now, other risk factors for syphilis include substance abuse, homelessness, and individuals with multiple sexual partners.
Okay, so since we're seeing, of course, an increase in women, does that mean that if a woman is pregnant, can she pass syphilis along to her baby?
Yes, and that is one of the major concerns with the rise of syphilis that we're seeing. Approximately 40% of babies born to women with untreated syphilis can be stillborn or can die from the infection. Babies born with congenital syphilis can have bone damage, severe anemia, nerve damage causing blindness or deafness. And that's why early detection and the treatment of syphilis is so important.
So if you have the early treatment and the early detection, how is that diagnosed and how do they treat them then?
Sure. So syphilis is diagnosed using a simple blood test. If you believe you could have been exposed to syphilis or have any of the risk factors of syphilis, we encourage individuals to get tested. Now, we offer testing at the Caldwell County Health Department at no cost to the patient. And we can help them to navigate through the process that if you do test positive, we can provide you the treatment and we can provide you with the further testing to make sure the treatment was successful. Now, your primary care provider, urgent cares, and emergency departments can also treat you for syphilis.
That's good to know.
And the treatment for syphilis is an antibiotic, Christy, that's been around since 1946. Penicillin.
Okay.
So for early primary syphilis, the treatment is just one injection of penicillin. For latent or unknown duration syphilis, the treatment is 3 doses of penicillin that are 7 days apart. And then what we do is we retest in 6 months and then again in 12 months to make sure that there's been no re-exposure and that the treatment was successful. So we understand the hesitancy to get tested and the stigma that goes along or is associated with syphilis. However, this illness will not go away on its own without adequate treatment and will develop into a more serious issue without treatment. So syphilis is a major health concern. It's a major health concern throughout North Carolina and even right here in Caldwell County. And I appreciate the opportunity to come and to talk to you today about syphilis and to bring this information to our public. So hopefully this will bring a greater awareness to our community and we can stop the spread of this disease.
That's awesome information, Chad. I love that. Of course, we're always at the health department willing to help anybody. And I mean, to me, like, we make people feel comfortable. We're in a great, atmosphere there. So come see us, right? That's all it takes.
That's right.
We give away free condoms, correct? And of course, like you said, the free testing. So tell us, what are our hours and do people need to make an appointment?
So appointments are recommended. Our hours are 8 to 5, Monday through Friday, and our phone number is 828-426-8400.
All right. Thank you, Chad, for being here. I appreciate all this information.
Oh, you're welcome. Thank you for the opportunity to come.
Yes, sir. So thank you for being with us today. If you have any questions, make sure that you call us at the health department. If you want to make an appointment, call us. Or if you just want to call and ask questions, please give us a call.